Hello, I'm Dr. Augustin with Bayside Chiropractic and Rehab, and today we're going to do a little talk about the common causes of pain in the neck and shoulders, which is fairly common with most people nowadays. There's different categories. So the first category we're going to talk about is your injuries or your trauma. So examples of this would be you were rear-ended, so you had a multi-vehicle collision or a motor vehicle accident, your sports injuries, your falls, your basically an injury or a trauma. Now, there's different things that can be affected and injured in a trauma. You can have soft tissue being injured, your muscles, your ligaments, your cartilage. You can have the actual joint being injured, which in most cases, most severe would be a dislocation type injury. But you can also have what's known as segmental dysfunction, which is your joint can get locked, it cannot function properly, and it can get swollen, inflamed with swelling. Then you have your bone injuries, which would be your breaks. Example would be a collarbone break in football is common, or you have a fall and you break your upper arm. Obviously, in these cases, most of the time, you would need x-rays to determine that. Sometimes there would be casting. In the case of a collarbone, there really wouldn't be. In most cases, it'd have to be very severe. You also have dislocations. Common causes in the shoulder would be, one of the most common is an AC dislocation, acromioclavicular dislocation. Again, common sports injuries, especially in football. I've seen them where people fall off a horse or they try to catch themselves, dislocate. Actually, that's not as severe as people think, even though it might be scary to see the little bone sticking up from your collarbone. Rule of thumb is if you have an injury and you think it's just muscle tension or muscle spasm, if that muscle is not starting to improve within 4 or 5 days, you should get checked out. Most muscle spasms will start improving within 4 or 5 days. So if not, you should be checked out. You're more than welcome to call the office and we'll find the appropriate care for you if we can't provide it. Okay, so those are your injuries. Now, another cause is repetitive trauma or prolonged use or prolonged position trauma. Great example is people work on computers or they play on Facebook and they're in a position for hours at a time. That puts a lot of tension on the neck muscles, puts a lot of tension. When the neck muscles get tight, the joints get compressed, and it can lead to joint dysfunction, inflamed joints, way down the road, arthritis, and then basically a degeneration of the joint completely. So a good idea there is these new desks that you can raise up and down. If you can't constantly change your position, at least have your computer screen at eye level so you're not looking down. If you love Facebook or social media, make sure you got it at eye level. Don't always be sitting down like this because it puts so much strain, especially on the posterior musculature. And it's very bad for posture. Another good example is a lot of people are working out at the gym, which is great, but you have to be careful. A lot of people do the same workout every day for years. This is not what you want to be doing. You want to be doing something where you're going 2 months, maybe 3 months with certain exercises, working certain things, then give your body a rest. A lot of times 2 weeks is the recommended rest. So if you're on 9 weeks, you take 2 weeks off. Then when you come back, you rotate your exercises. If you can rotate your exercises per muscle group, so you're always changing it, it's actually more effective because it's called muscle confusion, and actually more effective to build muscle and obviously reduce fat or burn calories. Common problems that you see in the gym: tendonitis, real common, overworking a muscle group. And the tendon is basically just where the muscle attaches to the bone. Muscle tears, muscle strains, and if you're really not careful and you're overlifting, you can get ligament sprains and actual, severe injuries. So lift what you're comfortable with. Don't try to compete with everybody else in the gym. Be very careful. Again, the rule of thumb applies. If things aren't getting better in 4 or 5 days, get help. Very important. There is a third group. These are more disease processes. Osteoarthritis is one of them, but usually one of these two causes the osteoarthritis, which is just degeneration of a joint. So if you do have osteoarthritis, doesn't mean you can't be treated. Most of the time we can keep you out of pain. It just means you might not be able to reverse the process completely. Then you have other disease processes like rheumatoid arthritis, which can affect joints in the neck. You have psoriatic arthritis, different types of arthritis. You have tumors, cancer of the bone, cartilage that can affect shoulder and neck too. But those are much less likely. Like they say, don't look for a zebra to start. This is a zebra. Usually it's one of these simple things. Don't start worrying that you have tumors. That would be a very unlikely scenario. It happens, but you should go through and get checked for all these other things first. If you have any questions or need to get checked out, please don't hesitate to call the office. Our number is 251-990-8388. In the coming weeks, we'll talk about some of the treatments we do for neck and shoulder pain. So you should stay tuned. I'll give some pointers on what exercises to do, what to stay away from, what kind of work you have to be careful with, and what you can do to mitigate some of the causes of these injuries and conditions. Be happy, be healthy. My name is Dr. Christian Augustin with Bayside Chiropractic and Rehab. Our number again is 251-990-8388. Thank you for listening.